The telemedicine industry is booming here in the Rio Grande Valley. Families and health professionals say it's saving lives.
CBS 4's Mike Jimenez tells us how a bill in the Texas House could expand telemedicine services.
It keeps us safe. It keeps us away from the harms that are out there currently with the different variations of the COVID.
Ruth Garcia and one of her sons suffer from pre-existing heart conditions, and both have had heart surgeries. She says doctors have warned her catching COVID could be deadly.
Basically, he is looking at a death sentence. I can plan his funeral.
During the pandemic, waivers were issued to expand telemedicine services, but those will only be in effect while there is an emergency order. House Bill 4 aims to make those permanent.
So that even after the pandemic, the new flexibilities to get telehealth and telemedicine services will remain there into perpetuity.
House Bill 4 would also expand services to vulnerable populations and expand services to Medicaid patients and other public benefit programs like CHIP.
We know that when we are able to provide telehealth and telemedicine services to those populations, that they get much better services. We've seen that emergency room intakes have gone down when children are able to access services by telemed and telehealth because they're seeing providers more frequently.
Nurse practitioner April Lopez with the Lopez Family Clinic says telemedicine has taught healthcare professionals to do things differently.
It has really saved a lot of lives. Telemedicine has really revolutionized the way we do healthcare now.
Lopez says telemedicine is the new now and will only get bigger and better and has increased access to care.
Patients who didn't want to come out in the middle of a pandemic just for a refill on something, patients who basically needed labs and were diabetics that were controlled, stuff like that, we were able to give everybody care. We were also able to give patients care who live real far away, as long as they had access to a smartphone.
For Ruth Garcia, she says she hopes telemedicine is here to stay so she won't have to deal with the worry and stress of catching COVID.
So I have chosen to do telemedicine to reduce that risk because, you know, a child is supposed to bury their parent, not a parent burying their child.